Going in the K-Wave News Zoom room, Dr. Tom Shieh. We also got Dr. Akimoto in queue, but we'll go ahead and break bread with Dr. Shieh. Good morning, Dr. Shieh.
Morning. Can you hear me okay?
We can hear you just fine.
You know, Chris, I know how you work now. You keep me on hold for 40 minutes just to listen to your show, right?
We need the views.
Anyway, I enjoy it.
Well, how's the show this morning, Doc?
Well, I thought that's good. That's always good.
Thank you.
I think it's good to communicate, and that's very important. And that's why I always emphasize that the message coming out of Loop and from the advisory council has got to be consistent. It seems like they're missing each other, And I caught the election part too. Remember after party that you invited me to? And what did I say about, you asked me the question, is election essential, right? And at that time I said, hey, I don't know. I don't think it's essential at this moment if we have a pandemic. But it's interesting to see the Democrats is agreeing with President Trump. And then you see the Republican is disagreeing with President Trump because Trump wants to postpone the election. And, it's kind of interesting how these politics go.
Yeah.
But I try to stay away from that.
No, you don't.
I think you want to talk about, let's talk a little bit about the number that came out yesterday, right? The 136 number that came out. It's interesting because I know that Dr. Hoa, the chair of the PAC, had mentioned that the capacity of testing on Guam can only do about 250 tests a day. But they tested samples of almost 1,000 samples. So 136 that they came out, the number sometimes doesn't match because was that all the samples came out from one day of testing? Because I thought we can only test about 250 a day.
Right. Doc, let me just clue you in before you go any further. What Public Health had said about this was that they were testing new contacts of COVID-positive patients and people with symptoms, and then also running portions of the 1,500 backlog tests. So, and you're right. I mean, they ran 954 samples, but they did also say yesterday that they were trying to enlist different clinics to run the tests for them. So, yeah.
Okay. So that they would be able to run about 500 to 600 tests a day.
Okay, so that's got to be consistent. Yeah. Dr. Hoa said we could capacity is only 250 to 300. But that's the problem right there, because when you did the mass testing, what happened? That you delayed all the results. I have patient that didn't get the result until 9 days later or 10 days later.
Yeah.
How do you contact trace? You really can't contact trace with results coming out this late. So those messages got to be consistent. What do you do, right? Now, as far as positive, we keep counting the positive. We have to find a way to sort of dissect out these positive. And I've been saying it for so many months because people who are asymptomatic, I personally don't recommend you getting tested if you're asymptomatic for over 4 weeks. The likelihood of you getting infected, sure, you can. Of course you can. But, if you put on your mask, wash your distance, wash your hands, I think it's going to be good. So I think CDC's also came out and said that, hey, the asymptomatic, maybe you don't need to test it. But again, you have to guide it by your local authorities, etc. They always say that. That's always a political way out for the CDC. But then always political pressure on CDC, just like WHO came out and said, hey, asymptomatic, unlikely it's going to spread. And then next thing, it turns around again. It doesn't make sense. But what I'm really confused about is the governor's advisors and the governor not on the same page. That's very important because the messages from our leaders, it's got to be consistent. If you want the people of Guam to follow you and to be consistent in what you say, it's so important to the people of Guam. Because if you're inconsistent, people is going to question you. And that question is already coming on board. And especially what happened in the last 48 hours, you come and you say, hey, the governor is not taking our advice. And the next day you say, yeah, well, we agree with her. Those are mixed messages. You have to be consistent. But again, you also remember that when you serve on a board that's appointed by the governor, you serve at the pleasure of the governor. So they don't get a pass like me. I don't serve at the pleasure of the governor. So I can speak out however I want. Even Dr. Akimoto, I see him in the Zoom there. But I think the key here is that if you serve under the governor, you serve at the pleasure of the governor. So if you're going to go to media and talk, make sure that you give the courtesy to the governor to making sure that you are consistent with your message. Because if you don't, then the whole island gets confused. And that's not good. Now, I like to also look at a couple of other things regarding the testing parameters here. We have to make sure that we target test. We have to test high-risk area, hospitals, airport, things like that. Contact tracing is very important. So those are high risk area that you want to concentrate on, not just calling people out. Hey, if you're asymptomatic, come on and get tested. Because if you really think about it, you call out 1,500 people, over 1,000 people the same day that you come out to get tested. Yeah, sure, they'll be in the cars, they'll be in a room, etc. But the problem here is that they don't just go out and get tested. They go out after that. They got to go eat, go shopping, things like that. So the message has got to be consistent. If you're asymptomatic, stay home. If you're sick, stay home. So the message is staying home, right? That's the message right now. Everybody going backwards again. Back in March, we're telling people stay home. And we did a lot of PSAs telling people to stay home. So we got to continue with that message, staying home. But if you tell people stay home, don't call out all the asymptomatic and go and come and get tested. So I think right now they're tracking backwards and say, hey, maybe that was a mistake. Mistakes are made, which is okay. Not a problem with that. But the message has got to be consistent.
Doc, you were at the Guam Memorial Hospital this morning. What's your read on it? Is GMH safe today?
Well, that's the thing here. We isolated GMH as the COVID hospital for Guam. I don't know where the concept come from. I don't know what the data is that says that we have to have one COVID hospital for the island. It doesn't really make sense to me because if you really think about it, if you have a patient who's sick, you want to get them the best care possible to save their lives, right? So if GRMC has good ICU, good isolation room, why can't we tap into GRMC and say, help us out? Or Naval Hospital, don't just isolate GMH because you want to get the sickest people to the best place to care for them and save their lives. We're doing them injustice by saying that we're going to concentrate in one hospital. And I disagree with that. And as for how safe GMH is, I still feel that it's pretty safe because I walk into GMH every day. I'm mask on. I tested myself. Oh my God, almost every orifice in my body has been poked because 4 or 5 times in 6 weeks, Chris, I tell you, I'm probably the only doctor that get tested this much, and I got my blood test too. And luckily, it's all negative. But the key here is that the maternity ward, the OBGYN side, we're still there. If they need rooms, then maybe we should go to GRMC. And I think we mentioned that before.
Wow, we're back to that, huh?
Oh, God, I think I heard this one before.
We're going backwards again. But, I think we need to prepare to say, hey, listen, maybe we shouldn't have one COVID hospital. If you look at all the other states, you see them designate one hospital as COVID hospital. Granted, they have multiple hospitals, I understand. Yeah. But if you have a sickest patient, Chris, if you're sick, okay, and I say, you can only go to GMH. I'm saying, wait a minute, GRMC has better ICU? Well, Naval Hospital has better ICU. Why can't I go there? Oh, well, no, cannot. We only can isolate you there. That's doing you injustice because we want to get you the best care possible, right?
You said prepare. That really is like a trigger for me because we didn't really prepare a whole lot. I mean, we still.
And there's no excuses for SNU. For example, SNU.
This chiller. Oh my God.
Hey, Dr. Shieh, we're going to bring in Dr. Akimoto, do a side-by-side with you. I don't know if he knows how to do this.
Hi, Doc.
Go ahead.
Dr. Akimoto, you there?
Let me unmute him.
Yeah, we're going to unmute him. Are you sure you want to unmute this guy, though, Jay? Are you sure you want to
What
unmute
is
him?
that? Unleash the Kraken!
I don't know if I want to unmute him.
No, he's good.
Hi, guys.
Good morning.
Good morning. Yeah, hey, thanks for not letting me wait. It was only 3 minutes today. Thank you. Really appreciate it. Hi, Dr. Shieh. How are you feeling?
I'm wearing a mask.
I'm wearing a mask.
I don't need to wear a mask. I'm myself.
No, Dr. Shieh has been working nonstop since March. He knows what's going on in the hospital. We're concerned because he and his nurses are on the front lines, and from the very beginning, we had been advocating that they move the women and children to GRMC for safety, and GMH had refused. Dr. Shieh had actually led a whole contingent of doctors and nurses to see if GRMC could handle this, and of course they can. They have a beautiful facility. But today is really about Dr. Manglona. This is about, I think, Dr. Shieh and I responding to Dr. Manglona's accusations yesterday that the community of Guam had somehow failed, that we had not listened to Dr. Shieh about washing our hands, that we didn't maintain our distance, that somehow Dr. Manglona, in her eyes, the only reason people are dying and that the hospital's been overwhelmed is because we didn't listen to her. I don't know how Dr. Shieh feels about it, and maybe I'll have to come off if I start using bad words, because FEC has this like red dot on my forehead right now. But the idea is Dr. Manglona has consistently belittled the doctors of Guam, the people of Guam. I mean, it looked like she was coming to Jesus for a little while in the PAG and actually making friends. But then yesterday, I don't know if she's racist, incompetent, or she just doesn't like people, especially if they don't work in the government of Guam. But how can you accuse all these business people who have spent hundreds of thousands of dollars to try to be safe and stay open? How can you blame Dr. Shieh, who sacrificed his family by being in Hawaii? You know, they're in Hawaii, but he's working his butt off. I mean, and he's in the private sector. He has staff that work with him and see people every day. How can you accuse these people of being the reason that we're in this situation? And basically she's saying, it's your fault. Live with it. If you're not going to listen to me, then fuck you.
If
she's going to do that, I mean, why the hell do we keep having her, you know, come on the air? She's toxic. She is toxic.
She's the medical director of public health, Doc.
Governor's going to have to figure out, are you going to use this? I mean, because today the virus is not the bitch. Janet Magnolia is a bitch. This is terrible. This is terrible. Yeah, soak in it. Let it marinate. Because yesterday's interview with her should have infuriated the entire Chamorro Nation. She accused them of not knowing how to wash their hands, to stay in place, and to listen to her. She's a pompous bitch.
All right, let's
Have
go.
a nice day.
Okay. Thanks, Doc. Right on. Well.
Doctor.
Whoa.
Yeah.
Am I muted or am I still?
Yeah. Okay.
Well, I can understand the passion that's coming out of my friend Dr. Akimoto there, and bless his heart, I think he needs to have a cup of coffee, decaf.
No, not coffee. Yeah.
Decaf.
I think he needs to have a cup of cannabis.
Yeah, decaf. And that's not a cup. That's 5 cups in a cup. Yeah. But anyway, I think I can understand the passion. I can understand the passion that Dr. Akimoto doesn't like the criticism on the people of Guam. Now, going back, if we can go back on what Dr. Akimoto is saying, okay? Why aren't we trusting the people of Guam? Why are we locking them up? The residents who's coming back from off-island, I've always advocated, if they have a house here, if they have a home here, please, Governor, do not lock them up in a government facility. I don't care if it's the Hyatt, Dusetani, wherever it is, Wyndham Hotel, Bayview, wherever it is, put them back into their homes. If we care about their mental health, the physical health, I think we all know that locking them all in a room is not going to help them. In fact, it may make them sicker. If they're not going to die or get sick with COVID, they'll come back out with something else, okay? I think it's important for us to understand that don't lock our own residents who's coming back home. Let them go home to their own families. You're going to say, we don't trust them being their own homes. How can you say that, Governor? Because Dr. Akimoto is already saying, Dr. Magnolia is saying, hey, don't trust the people, they're at fault, etc. I haven't heard she said that, but that's probably was in your segment. But the same thing is coming from the top. The governor and the Physicians Advisory Council is saying, we don't trust the people of Guam. We don't trust you coming back home and you're going to stay in your home. We don't trust you. We're going to lock you up in a hotel for 14 days. We don't care. Or 7 days, whatever, how long it is, because you may be positive. Well, they have a home here. Let them go home. I think that's the best thing you can do. You have to earn the trust of the people of Guam so that they can trust the government. If the government doesn't trust the people, how can you lead the people, right? That's just my last opinion for you regarding how we're treating the people.
Right on. Dr. Shieh, I just got to chime in because I just had this conversation with a friend last night. I think Dr. Maglonia reached that point where she was like, hey, come on, guys. We told you what we got to do. Obviously, if we're seeing widespread community spread from people who are violating their home quarantine, from people who are having gatherings and all that stuff, right, Dr. Shieh? So I
can understand Dr. Magnolia's frustration.
Right.
Let me tell you why. Let me tell you why, Chris. We're going on what, 7, 8 months now with this virus. I got the feeling the virus was here since January to Guam. Now, the reason why we didn't know is because we didn't do any testing until March or end of February. Now, I can understand Dr. Magnolia's frustration. I give her that credit. I'm not as critical as Dr. Akimoto because Dr. Magnolia does not control public health. She does not control. You have to look at the top. If you're going to blame her, you got to blame way on the top. Who is in charge of the island? Now, going back to all this breaking of quarantine, etc. I wrote that in the post, and I wrote the letter. I said, you got to be careful of quarantine fatigue. Quarantine fatigue is very real, in my opinion, because people are tired. They're tired of what's going on because we don't trust them, right? So people who's coming out of the hotels, etc. Yeah, sure, they're not infected in 10 days, but you think they're going to stay in their home and right now, they're dying to get out. They're dying to go out and making sure that, hey, they can get some fresh air and go to Burger King or somewhere else to get some food because they're locked up in their hotels. The quarantine fatigue is very real, in my opinion. So I think those people coming back from off island, their families here, please let them go home. You gotta let them go home. Come on, Chris. Don't lock them up. Majority of them are not even positive.
Well,
and even if they are positive, if they're asymptomatic, how do you know they're not a past infection? They could have caught the virus 2 months ago, but you still test positive, right? The CDC says that. And look at Lieutenant Governor. If you look at them as a good example, and I'm so happy that they're well because they got well pretty fast.
Right.
And I want to know if they use hydroxychloroquine, by the way.
Come on, Doc.
Because as a doctor,
now you're going off into crazy town.
Anyway, getting off that subject. But here's the thing. Taking those examples, Dr. Also tests positive, but all three of them, the 3 cases, all test negative when they're asymptomatic. Only when they're symptomatic they turn positive, right? So now that they're out of it, 10 days, 40, whatever you may call it, they're out of this positive now. Are they going to test them again? No, they're not going to test them again. Why? Because CDC has said you don't test them again for at least 3 months. 3 months. Why? Because they may still test positive. And why? Because the PCR that you're using tests dead viral shedding particles, which does not determine you if you're actively positive versus your past infection. Just what Lieutenant Governor has.
Right.
So, be as it may, I think we gotta try to see how we can discriminate or dissect out the positives. See who's past infection and see who's currently infected. That's very important. And we're still spinning. We're still going around. And have a cartoon out there. We're chasing our own tails. But like Dr. Akimoto said, I go to hospital every day, and I'm going to go back there after I talk with you, and I have patients up there. I feel safe going to the hospital because I protect myself, and I test myself. I don't have to because CDC says healthcare providers, essential personnel, you don't need to be tested. There's no longer what we call testing protocol monitoring for essential providers. In fact, they're coming out and saying that use symptoms monitoring. That's the key, symptoms monitoring. So I think I've said enough. I think it's important that we trust our people. There's people who are still locked up in the hotels. Please free them. Let them go home. They have homes here. There's mothers in the hotels that have kids at home that they want to be with. Quarantine the whole family if you want to at home. At home. Stay home. Not stay in the hotel. The message has got to be clear. If you want them to stay home, that hotel is not their home. Their home is in Jigo. Their home is in Deredo. Their home is in Tomuning. Talofofo, that is their home. Stay home, but send them home, not in the hotel.
Thanks, Doc.
Okay?
Thank you.
Right on.
Can I go now?
Yeah, you can go. You clock out. Clock out, okay? I'll see you.
All right, Chris. I'll talk to you later.
See you, Doc.
Bye, Sabrina.
Bye.
All right.
I just want to say this because that was just really, for me, just uncalled for with what Dr. Akamoto, the words he used to describe.
Of course, yeah.
I do not think that
Racist?
Dr. Manglotnia is a racist. And
that's crazy.
Honestly,
you're crazy, Vince.
If she's a bitch, I'm a bitch.
Yeah.
Because if I'm that passionate about what I'm doing, I mean, she has been putting in the work, and I'm sure Dr. Akamoto has too. But she's come on the air. She's expressed her frustration. She's done the public service announcements. Everybody at public health working so hard, maybe some not so hard. But, just to call her a bitch, I'm a bitch too.
Yeah, I'm a bitch.
No, you know what's really
I'm a big bitch.
COVID's a bitch.
Yeah, well, okay, but I just got to say again, this idea that somehow we, the people of Guam, don't bear any responsibility for the widespread virus it's crazy. Of course we're responsible. And of course the government of Guam is too. That's the problem that I had with what Dr. Manglotnia said is I know that she is putting it on us because they told us what we had to do. And guys, let's be honest, we didn't do it.
Yeah.
Okay, let's be real. We deserve part of the blame. It is what it is, guys. You know, you guys were going around. We just had Big Tone on. What did he say? I was doing things I shouldn't have been doing. I was going around to where there were a lot of people. I was bringing my son with me to where there were a lot of people. So it's a little, to me, it's just a little much to just call Dr. Manglotnia a racist because she's frustrated that people are getting sick and dying. That's kind of what doctors do. They tell you what you don't want to hear. I'll go back to the story I had where the doctor was like, yo, Chris, your heart's going to pop. Do this, or that. So I did what I had to do, and I'm still sitting here today.
Yeah.
So, I mean, again, I just want to go back to, yes, public health. Yeah, the backlog of tests, it's crazy. We have people running around and no idea if they're positive. Big Tone was one of them. He got a negative result. I mean, 10 days, and he'd had COVID the last 9 days. So, yeah, the government has failed, yes. Mm-hmm. But we have also failed, too, okay? All right, that's my 2 cents. I know it's more like $1. But I'm sorry, I know we don't want to hear it. We just want to think that somehow we're, you know, above being blamed, that we're the victims in all this. Yeah, in some ways we are, but also we're the ones that are spreading it to each other. Whether or not it's because of our culture, like, who was that came on and said that this virus preys on all the things?
It was Dr. Cabrera.
It was Dr. Felix Cabrera.
It preys on our culture.
It preys on our culture and our ability and our desire to just intertwine with each other and to go check Auntie, to go check Nino, to go check Nina. This virus, it's going to get you when you do the things that make us Chamorro, that make us Islanders. 8:43. We're going to take a short break, and we got Daphne coming up. And then we also just got a text from Lillian, Posada Square.